Hello, Mrs. Kim. I understand you've brought your daughter in today because she's been having stomach problems. Could you tell me a bit more about her symptoms and when they usually happen?
Yes, doctor. She's 4 years old, and for the past few weeks she's been having frequent stomach aches and loose stools. I've noticed it happens more often after she drinks milk or eats ice cream. I'm really worried. Could this be something serious like an infection or a long-term disease?
I can understand why you're concerned. From what you've described, and based on the tests we've done, it looks most likely that your daughter has lactose intolerance. This means her body has some difficulty digesting lactose, which is the natural sugar in milk. The undigested lactose stays in the gut and causes stomach pain, bloating, and diarrhea. The good news is that this condition is not dangerous and is usually quite manageable.
So it's not an infection. She won't have long-term damage. I'm also worried. If she can't drink milk, how will she get enough calcium for her growth?
That's a very good question. Firstly, no, it's not an infection and it doesn't cause long-term harm. It only causes discomfort when she consumes too much lactose. Secondly, she doesn't have to avoid all dairy completely. Some children can still tolerate small amounts of yogurt or cheese because those have less lactose. There are also many lactose-free milk options available, and these are fortified with calcium, so she will still get the nutrition she needs. In addition, foods like broccoli, spinach, and fortified cereals also provide calcium.
I see. But is there any treatment, like medicine, or is it only about diet? I'm just not sure how to manage it at home.
At this age, the main approach is dietary management, not medication. The best way is to avoid regular cow's milk, use lactose-free milk or alternatives like soy or almond milk. Gradually reintroduce small amounts of dairy to see how much she can tolerate. I also recommend keeping a food and symptom diary. Write down what she eats and when the symptoms occur. This will help us adjust her diet more precisely.
All right. And when should I bring her back to see you?
Good question. Please bring her back if she continues to have diarrhea even without dairy, if she loses weight or seems very tired, or if you notice blood in her stools. Otherwise, let's review her progress in about a month, once you've tried the dietary changes. That way, we can check her growth and make sure her nutrition is on track. You're doing the right thing by bringing her in early. With the right diet, most children live perfectly healthy lives with lactose intolerance.
Thank you, doctor. That makes me feel much better. I'll try the lactose-free milk and keep the diary.
You're most welcome. Don't worry. You're not alone in this, and we'll support you in managing her diet. She'll be absolutely fine. Lactose-free options: yogurt and cheese, some tolerated. Broccoli, spinach, fortified cereals. We'll check her growth and nutrition at follow-up.
Thank you again.
Take care. Call if you have concerns.